My message is for you who have diabetes and are here looking for information about osteomyelitis and orthopedic infection. My name is Mário Soares. I'm an orthopedist specializing in osteomyelitis, infected prostheses, pseudoarthrosis, and orthopedic complications. And I can't help but mention that one of the biggest links between this whole topic that we deal with here on the channel is at the same time diabetes. What is diabetes? Diabetes is a disease of the microvessels. In other words, I have a change in those little vessels that exist in various parts of the body. They start to clog up and I start to suffer some damage. Deixe. One thing you always hear about, even the name of the disease, is diabetic foot. I'm going to talk here in this video about diabetic foot, which is a very specific type of orthopedic infection and the effects that diabetes has on all the other types. Let's talk about the diabetic foot. What happens in the diabetic foot? When these small blood vessels are compromised, remember that the nerves also have vessels. So if the vessels are damaged, these small nerves also stop working. And they are sensitive nerves. So you think that a patient who has been treated badly, who hasn't had regular treatment, who has had diabetes for a long time, who hasn't taken care of it properly, who is very careless, will start to experience the death of these sensory nerves, and the sole of the foot will no longer feel it. Then it starts to hurt, to make wounds, and there bacteria start to get in. And remember, if I don't have tiny blood vessels, my immune system can't get there either. So I have another complication of diabetes, and I start to get these sores that we call diabetic foot, plantar perforating disease, and it starts to destroy and gets deeper, until it reaches the bone in the foot, and then osteomyelitis. There's no way out, there's no blood supply, there's no way to treat it, and the disease gets worse and worse. And normally diabetic foot is not caused by a single bacterium. We call it polymicrobial. Because of the environment that is favorable there, because of diabetes, because of the care provided, because of their own feet, because of the way the patient is treated at home, it becomes a totally hostile environment, but one that is suitable for bacteria. And these are bacteria that are usually different from those we see in other types of infection. There are various ways of treating diabetic foot, bearing in mind that in the most serious cases, patients progress to greater and greater amputations. So this is a specific type. The other question is that in other types of infection, diabetes acts negatively. It's like I said, I have a problem with the vessels. I have a lot of difficulty, firstly, in healing. Secondly, for the defense cells, the immune system, to work in that region, and also for the antibiotic to arrive, for example. So everything is more complicated in diabetes, and we know that this correlation is very harmful. So if the patient has an infection and they have diabetes, I know that the prognosis is much worse. They go from a stage that we call a type A patient, which is the healthy patient, to a patient who has a systemic comorbidity, in other words, that affects the whole body extremely seriously. So we have to be aware, sometimes the post-operative period is much more complicated. There are several details that I have to take into consideration, and also the following. There's no point in doing the treatment if the patient hasn't compensated for their diabetes. So we have to involve other professionals to be able to carry out the treatment. You have to adjust the diet, you have to adjust the endocrinological medication, you have to see if you're taking insulin or not. It's much more complicated. But remembering that it has a very deleterious effect on the situation as a whole. It's very common to have this association between osteomyelitis and diabetes, or prosthesis infections and diabetes. So remember, if you have diabetes and are going to have orthopedic surgery, it's very important that you are compensated. It's a way of preventing a problem that could happen, because the chance is greater than a patient who doesn't have it, without a shadow of a doubt. If you have diabetes, this is your case. Get in touch with us, ask us questions. We'll arrange a teleconsultation, a face-to-face consultation. Send a question to the clinic. We're here to help you. You won't find another channel as rich in information about osteomyelitis and infections as this one. So this is designed to help you, especially you who have diabetes. Cheers.